Hello, my name is Steve Long, and I'm the CEO at Hancock Health, located in Greenfield, Indiana. I hope that you'll learn some interesting things in this time that we have together. This is a follow-up to a meeting that we did virtually just about 12 days ago on March 16th. I'm recording this today on Sunday, March 29th, so we are 12 or 13 days into the future now. A reminder of what SARS-CoV-2 is. So coronavirus is the family of the disease. The SARS-CoV-2 is the virus that we are talking about, and the disease it causes is COVID-19. And it emerged in China back in 2019, spread, we believe, through respiratory droplets. So if you're within 6 feet, that's the kind of the cone that would be difficult for you to avoid getting the disease. And the testing so far worldwide has been focused on those that are most at risk of getting the disease, either because they are a person with pre-existing conditions or they are at an age that might make them have a higher risk. The symptoms, of course, are fever, cough, and shortness of breath. And I tell you, if you have a pre-existing comorbidity and any of those symptoms, then you're going to be seen right away. There's a wide range of severity that we see in this disease. 80% of people will get it fairly mildly, meaning that they likely won't be in a hospital. Another component will be more severe. They would be ones that might require oxygen, so they would be hospitalized. And then about 5% would be what we call critical, and they would be in an ICU, likely on a ventilator. And about 1% to 2% we know will die from this disease. And again, we know that being over the age of 60 is a risk factor. Many deaths are now recorded in those over the age of 80. But what we have been learning is that this is a disease that affects all of us. You can see in this chart below, these are different age ranges, and you can see that all are at risk of getting the disease. All are at risk of hospitalization, but the risk of death is much higher in those that are older. Now, one of the things that I've been asked quite often is, what is the difference between COVID-19 and the flu? I mean, the flu comes every year. It makes a lot of people sick. It kills a lot of people, in fact, more than we've seen so far with COVID-19. So what's the big deal? Why don't we just kind of ignore it and do what we do with the flu? Well, I've put a few things here on the slide. I hope you can see this. That shows that it is really fundamentally different than the flu. The incubation period for the flu is 1 to 4 days. You get sick quickly. For COVID-19, it's 2 to 14 days. So it's a gradual onset. You might not even know that you have this disease, and you could be shedding the virus while you are there. It is pretty contagious. In fact, 2 to 3 times more contagious than the seasonal flu. And the problem is that while we know that the seasonal flu will affect on average, say 8 to 10% of people, and in a bad year, maybe 20%, we really don't know what the infection rate could be for COVID-19. It is a novel or a new coronavirus. So with flu, we have many antiviral treatments. With COVID-19, we have none. With the flu, we have the seasonal vaccine, and it's not always great, but 50, 60, 70% of the time, it works pretty well. We have no vaccine for COVID-19 and probably won't for at least a year to 18 months. In the flu, we have centuries of natural immunity that have been built up by humans. And in fact, maybe for a couple of millennia, we have no natural immunity for COVID-19 because it is new. For the flu, 1 to 2% of people that get it will be hospitalized. And for COVID-19, it's 10 to 20%. So it is 10 times higher than for the flu. The mortality rate, and this is the big one, for the flu is about 0.1%. We don't know exactly what it is for COVID-19, but it appears to be between 1 and 3%. So it is at least 10 times as deadly as the flu. So I hope you look at all of this and you see that really what we have here is something that's different than the flu, and we have to treat it differently. Well, back on March 16th, when we last talked, we looked at this chart and we were concerned because it looked like the total number of cases in the US was beginning to increase at an exponential rate. So it was increasing a little more every day, and certainly you can see that. And the reason we were concerned about that is that if you look at this chart, there are 2 curves. One is the yellow one, and this shows an exponential growth pattern. The other one, the blue one, shows a much more gradual growth pattern. And then the line that you see right across here is the capacity of the healthcare system. So the concern we have is that if this is truly on an exponential growth pattern, that it could quickly overwhelm our healthcare system, and that the number of patients that would require the services that we have, especially in the ICUs and with ventilators, would be overwrought. We would not be able to care for everyone. So the whole idea is that we need to make sure that this does not continue to grow exponentially so that we can eliminate this period of time where the hospitals would be unable to take care of not only the ones with COVID-19, but other people that would need hospital-based care as well. So where did we go after this? You may recall that I showed you this table, and it put this all in terms of Hancock County, and we have about 80,000 people in the county. And we said that if we looked at an infection rate of, say, 10%, we would have 8,000 people infected because there's 80,000 people. About 6,400 would have it minimally. About 1,100 would be sick enough to be in a hospital, and then another 400 would require ventilators, and then 80 would die. Also reminded us that our hospital has 80 beds. And while we're very, very good, we are not big enough to care for those numbers of patients, especially if they are packed together in a short period of time. I mean, a number of patients like that, we would need to stretch over about 6 months to be able to do that on top of our regular workload. And I told you that we had a number of initiatives that we had started internally back on March 16th, and these were really to create capacity inside of our hospital so that we would have space for the coming surge of COVID-19 patients. You can read through this list, but it really was all about making sure that we redeployed our staff, that we decreased the number of elective things that we were doing, and we opened up space so that we can house more patients inside the hospital, and then reduce the risk to the people that are inside the hospital as well. One of the big things there was limiting entry, and I will tell you that we're recording this on Sunday, March 29th, and tomorrow, Monday, March 30th, we will end in-person visitation to patients in the hospital. We will have e-visitation or virtual visitation available, but we will no longer allow in-person visitation. That's the point that we're at. We also did a number of things externally. We closed our wellness centers. You may know that. We have 3 wellness centers. We have almost 10,000 members in those, so we closed them for the time being so people would not congregate, and so we could take the staff and redeploy them into the disaster teams that we have developed. We created our COVID triage phone line, 317-325-2683, and our Ask a Nurse line at nurse@hancockregional.org. We created our Hancock COVID triage clinic as well in the old IU Health Clinic space down by Kroger. We revised our patient intake processes for our physician practices to ensure that patients with respiratory illnesses and signs and symptoms that might be COVID could be sent directly to the triage clinic. And then we have really tried to move most of our physician practices to a virtual environment. In fact, if you go to My Virtual Health Visit and look for that app on the App Store, either in Google Play or the Apple Store, you will find it. You also can participate with us in these virtual visits. We have done all kinds of things with posting information on a regular basis on our website and social media platforms. And then we have partnered with everybody and their brother in the county. I tell you, the list of people to thank is far, far too long. But I hope that you can look at this list and know that we are not doing this on our own. It is the result of many, many people coming alongside to help us get this done. So here's the big question. What's changed since March 16th? I mean, that was 12 days ago. Has much changed? Well, you may recall on March 16th that we had this graph, and it showed again the number of cases in America. It was about to hit 5,000, which seemed like it was quite a lot. And it also was taking on this exponential growth pattern. Well, let's see what's happened now. Well, here again is that 5,000 number from March 16th, and it is the same one that is down on this graph. And you can see now that since March 16th, in the last 12 days, we have had rapid growth in the number of cases in America. In fact, we are up to 125,000 cases now nationally. If you look at the world, back on March 16th, we had about 150,000 cases worldwide. And then again, if you follow this line right down here, you can see that that number of cases is far down on the graph. And we just, I think today, went over about 680,000 cases worldwide. So we've had huge growth in the last 12 days in terms of the number of cases. In fact, if you look at this great website from Johns Hopkins University, you can see that containment has failed. The disease is everywhere, all over the world, and in particular, it has invaded America. You can see all of the red spots. They are growing literally by the hour, and some of these spots are considered hot spots. You might know Indianapolis is one of those. So let's look at our state, and back on March 16th, we had 30 positive cases that had been identified. 2 folks had had died from the disease. Fast forward 12 days, we now have 1,500 cases, and there are now more deaths, 32 deaths, than we had total cases just 12 days ago, and almost 10,000 people have been tested. And let's look at a subset of that. You know that about 1/4 of the population of Indiana lives in Marion County and in the 8 counties that are connected to it. And that makes up 1/4 of the population of the state of Indiana. Unfortunately, these same 8 counties are the ones that account for 2/3 of all of the COVID-19 cases in Indiana and half of all of the COVID-19 related deaths so far. So 1/4 of the population is driving 2/3 of the cases and half of all of the deaths. This is very troubling. If you were to take a bit of a step back, 685,000 cases had been identified worldwide as of this morning, 125,000 of those in the US. This is a list that I don't think we wanted to be number one on, and yet here we are. But if you go and dig into that website a bit deeper, what you'll find is that you can sort the data and look at all of the numbers for the state or state equivalents worldwide. So if there's a state or a province or a dependency, it's called different things in different countries, it would list those out. And no surprise, the number one on that list is Hubei, China, which is where Wuhan was. Also no surprise, New York is number 2, and it's likely to pass Hubei province here in the next couple of days. What you may not know, though, is that on this list of 18 states and provinces worldwide, Indiana is number 18. So we have the 18th highest rate of any state in the world, the number of cases. So it is no surprise then that Dr. Jerome Adams, the Surgeon General for the US, just this morning called Indianapolis an emerging hotspot for the COVID-19 disease. This is a wake-up call. So how bad could this get? And I'll tell you, I might scare you just a little bit here, and I apologize for that, but I think it's important to know. So you recall, we just looked at this. So this was on the left, March 16th. On the right, it's current, March 28th, March 29th. So that means that all of that growth happened in the last 12 days. So let's just say, what would it look like if we forecast this 12 days into the future? So let's have a base point that we can look at. So this graph takes that same data that you saw on the previous slide, and it puts it into an Excel chart. If you're an Excel user, that's what I use. And it's easy to put an exponential trend line on that. And you can see, actually, if you did this, it's got a 98% fit. So then we take this and we say, what would that look like if we extended it 12 days? Well, you can see that our current number right here of about 1,500 cases shows up way at the bottom of the graph. And in 12 days, which would be April 10th, 10% of our state would have the COVID-19 disease. But what would it be if we extended it 12 days after that? So again, we have today, this is March 28th, this is the data we have, and it is this small spot down here, and 24 days from now, on April 22nd, if nothing changes, 40% of the people in the state of Indiana would have the disease. 40% of the people. That is about, well, it's not quite 3 million people. We have a state of about 7 million. So 3 million people would have that disease. That is frightening. But here's the good news. I don't think this is actually going to happen. It could happen. Certainly the numbers would say it can happen, but I don't think it will because we have done things. The federal and state governments have acted. You know, the federal government put in the travel restrictions from international travel, have provided more testing resources, although we need a lot more testing resources. Financial supports, the CDC has recommendations. The state early on closed restaurants and bars and limited gatherings to less than 50 people. So churches essentially shut down, universities closed, the K through 12 schools closed, the state sent non-essential workers home. And then just last week, the governor issued the stay-at-home order. This is the shelter-in-place order that basically says, unless you need to leave your home for an essential reason, things like going to your doctor, going to the hospital, getting food. So you're not to leave home unless it's for one of those essential reasons. So that's been in place for several days now. Our local authorities took bold steps very early on. Hancock County issued the travel advisory. The city of Greenfield issued the emergency declaration, and it has been followed by the towns in the county. And then, of course, in Hancock County, we formed the COVID-19 task force, and it is led by our emergency management agency. Misty Moore is the director there. It's made up of government, law enforcement, first responders, educators, business people in our communities, healthcare, the health department. All of us are together at the same table working on our interaction with this disease and what we can do to stop the spread. So again, it had taken on this exponential curve, and that exponential curve looks very much like this bad case that we would see here. But we have taken actions to try to keep this from actually becoming a reality. So I left it last time and said our task was this: social distancing, which is really, in my mind, physical distancing. Social distancing, you can be social at a distance via your smartphone. I think we probably all have one of these, and they're very easy to use, and FaceTime is our friend. I said at the time that we had 2 weeks to turn the tide. The question I would have is it working? I think the better question is, what if we hadn't done what we have? How much more quickly would it be growing, and what would it look like right now? But when you look at the data, it's clear that we have 8 to 10 weeks to keep this up. So we're making changes. We have to keep it up for 8 to 10 more weeks. Well, I had also mentioned that success in the end would mean that we didn't get hit really badly with this. There's no way that we're not going to get hit with it. We are already being hit with it, but we can mitigate it. And if we're successful at that, people will think that it was all overhyped and it was craziness. And in fact, there are many people that look at this right now and say, we cannot possibly keep this up for another 8 or 10 weeks. I mean, the economy has already tanked. You drive around town, you see signs on doors and it says, because of the COVID-19 virus, we are closed. We saw the stock market take a 30% hit in a matter of a few days. We saw unemployment jump by 3 million people overnight. It is incredible what we're seeing. And it's no wonder that we're beginning to see articles that are out there that are asking the question, is the cure worse than the disease? Meaning, is the economic hardship that we're putting on people and the impact that will have on health and ultimately on the death rate, is that worse than the actual disease? And I get it. I really do. I wonder these things myself. But there's something that we need to keep in mind. And when you look at the growth rate of this disease in America and you compare it to the other countries in the world, we're in a bad spot right now. This is not good. I think we have to just be clear about it. We're not China. You know, the way China did it is that they put their military and they actually put a cordon around their major cities, and they didn't let people in or out. Now, can you imagine us doing a blockade of New York? Hard to imagine in America. And we also are not Singapore and Japan and South Korea, where they had testing resources at the very beginning. They identified the people that had it and quarantined them. So we've done neither of these. We have not tested early, nor have we really put into effect this order that you couldn't leave your home at all. So we have to know that we're in a different spot than other countries. This is growing much more quickly. And the fact that we are number one in the world now is very concerning. So let's suppose that we did just stop all of this. Let's suppose that just next week the governor said, we're done with that. Everybody go back about your business. We're going to take good care of the people that have it, and we'll just move on. And maybe it'll be bad for some of the older folks, but you know, it's better in the long run. Well, here's the thing, is you can't make that decision. And here's why. Because number one, this affects people of every age. So this is an actual graph from Indiana. So we can see that people of every age group can get this disease. And we know the statistics on how many people are going to end up in the hospital and how many people are going to end up on ventilators, and it does not discriminate by age. The death rate seems to discriminate by age, and that's about it. So if we had 60% of the people in our county that got this disease, then we know that we would need about 8,000 or 9,000 hospital beds. And if we had 80%, then we would need like 11,000 or 12,000 hospital beds. I'm here to tell you, the entire state of Indiana could not support the healthcare needs of the people in Hancock County if this happened. What that means is that if our hospitals are clogged up with people with COVID-19, then if you're in a car accident or you have a heart attack and you're brought to the ER, you're not going to get in because the hospitals will be full. So the choice that we think we have of let's rescue the economy and just let the disease take its course is not a real one. There's no way that we can get past this. We either get the impact on the economy now, or we get it later, only much, much worse. So it's a bit of a false question. So here's our goal at Hancock Health and in Hancock County, is that we believe that if we could keep this down into the 1.5% range, so 1.5% of us would actually get the disease, that would be manageable if we stretched it out over a bit of time. Because let's say we had 2.5% got the disease, then we would need to have about 400 people in the hospital, and about 100 of those would require ventilation. And if we could spread that out over about 12 weeks, then we have the resources internally to take care of that problem. Now, you may look at this and say, well, hey, we got the big hospitals in Indianapolis. They'll be our saviors. I'm here to tell you, they're not going to be our saviors. They're already filling up. They are identifying places where they can build off-site hospitals now. Watch Italy. This is happening in America right now. You know, in New York, they've just built 4 1,000-bed hospitals in arenas. The same thing is underway in Indianapolis. So we cannot depend on the big hospitals to save us. So we need to try to make this thing handleable, or manageable, right here in Hancock County. And this is about what we think it's going to take. So the infection rate of 1.5% would give us this curve. We're about 2 weeks into this already, and at the peak, it would be all we could do to handle that number of patients, but we could do it. We have an extraordinary team here. We have developed plans so that we can handle this kind of a surge. So this is what we're looking at, and if this is what we get, we can make this work. So here's what I'm going to leave you with. We have a choice. And I'll tell you, the choice is not a choice for healthcare providers. It's not a choice of hospitals. It's not a choice of governments. It's an individual choice that we each are making on our own and with our families. And that choice is going to be to practice the things that we've said, washing our hands, elbow bumping and not shaking hands, not covering our face and not touching our face. I'll tell you, maybe putting a mask on the face is the best way not to touch your face, because I do it all the time. Cleaning the surfaces. I cleaned this surface right before I started recording this. Physical distancing, right? Staying at home is the key. Patience. I think at the end of the day, it's going to take patience, because this is going to be hard. I'm telling you now, you already know it. This is going to be hard, but we have to do it. And I know that we can do it together, because I know that we have a choice, and we're going to make that choice. And we're going to make the right one. I'm going to leave you with this. One of my favorite Bible verses is 1 Corinthians 13:13. And it says, in the end, these 3 things remain: faith, hope, and love. But the greatest of these is love. And at Hancock Health, we have a motto. And it is, what a blessing it is to work in a place where we love people for a living. So please know, we are here to care for you. And we're all going to do this together. But we have to make the right choices. So thanks very much for watching this video. Please go out to our website, hancockregional.org, and you can find all kinds of resources. Look at our social media page. We are uploading resources and videos every day. And every Friday, I'm on Facebook Live, 9:45 in the morning. So thanks very much, and I hope you have a good day.